2008, kami memulai produk Yati.
2016, kami beralih ke perusahaan startup dan sekarang kami punya Seven Wonders. Ada di bidang retail, kafe, pabrikan tekstil, spa, emas, pet shop, apotek, dan kosmetik. Konsumen kami tersebar dari Aceh hingga Papua. Kami memberi solusi bagi UMKM dan UKM. Dan juga kami memberikan pelatihan dan pendampingan.
Visi kami menjadi standar software terbaik bagi para pengusaha Indonesia. Dari dulu, saya memiliki kecintaan di dunia IT. Dari awal, sistem install satu persatu produk secara manual. Sekarang, user bisa konsultasi secara online dan mendapatkan demo gratis juga secara online. Bahkan, hanya dengan 2 detik saja pembayaran diterima, program sudah bisa instan siap dipakai.
Misi kami membangun Duta Digital Indonesia. Saya sangat senang menganalisa sistem perusahaan dan mengefisiensikannya dengan teknologi. Salah satu kendala di lapangan saat implementasi adalah bahasa dan alat. Oleh karena itu, kami membuat seluruh software kami berbahasa Indonesia. Kami berikan bantuan juga berupa WhatsApp Group, support tiket, dan sertifikasi di Lemtron.
Di Indogo,
Kami percaya
everyone is CEO!
Nah, halo teman-teman. Sekarang, hari ini kita akan ngadain ngebis atau ngobrol enak soal bisnis bareng sama salah satu tamu yang sangat spesial sekali hari ini. Nah, kenapa dia spesial atau beliau ini spesial? Wah, karena beliau ini adalah seorang dokter dari Nepal sana. Nah, kalau ngobrol tentang bisnis atau bercerita tentang bisnis, saya yakin teman-teman di rumah semuanya udah pada tahu bahwa Landmark ini adalah perusahaan software ready to use, back office ready to use. Nah, kenapa? Karena di Landmark ini kami memiliki software yang sangat banyak sekali, cukup banyak, dan tentunya instantly. Jadi kayak mie instan ya. Mie instan ready to use only 2 minutes and then you will have your own software in your sebagai back office-nya. Nah, jadi teman-teman, jangan lupa nanti kalau misalkan ngerasa bahwa aduh saya juga perlu nih melakukan digitalisasi, melakukan sistemasi back office-nya, langsung kontak landmark.com sekarang. lanmarc.com di 089626005000. 089626005000. Oke. Hari ini kita sudah kedatangan tamu yang sangat spesial sekali, namanya Dr. Suraj Maharjan. Oke, tapi sebelum saya panggilkan beliau, saya akan bacakan terlebih dahulu. I will read his CV first. Sorry. Okay, this is Dr. Suraj Maharjan. For I know the plans I have for you. Wow, this is his quote. His education is from 2001 until 2007 is MBBS in Xinjiang Medical University in China, and then 2010 until 2013 is Master of Surgery in Jilin University, China, and 2013 to 2017 he's doing the doctorate degree in plastic surgery in Jilin University, China. His name is Suraj Maharjan. He's come from Nepal, from Pokhara. So his workplace now is he is as plastic and reconstructive surgeon in INF Green Pastures Hospital and Rehabilitation Center in Pokhara, Nepal. So what is his interest is special interest. What his interest is in hand and peripheral nerve surgery. So this is about leprosy and spinal. I think we will ask more about all of this later when we talk about with him. Okay. Hello, Dr. Suraj. Wow, nice to meet you. Nice to see you again. After a long time not see you. Yeah, it's such a long time. Actually, I met with Dr. Suraj, I think it's almost 7 years ago back when I'm still in China, but it's really nice to see you again in this time, by the way. Okay, Dr. Suraj. Okay, brother. I want maybe our listeners they still don't know about you. Maybe you can explain. You can introduce yourself. Who is Suraj? You come from where, born where, and where do you school? Maybe you can explain to our listeners, please. Yeah. Namaste. Hmm. I saw it. Hmm. Wow. Wow. That's cool. Oh. Wow, that's cool. That's cool. Wow, of course you also passionate about what you're doing. That's the thing. For the listeners, the thing is like Dr. Suraj doing is like plastic surgery. Maybe some of you thinking like he's doing the plastic surgery to make something not beautiful to become beautiful or what? Maybe you can explain about it. Or it's much more like from burning things. So you fix it. Ah, yeah. Ah. Hmm. I see, I see. Yes, yes. Hmm.
life.
Ah, okay. That's great. Okay. By the way, when I see like about your what about your CV, I saw it that uh you spend all of your time to study in China.
Yeah.
So, by the way, why did you choose China?
Yeah.
If
Yeah.
I want to know.
Yeah. It's like my I even share with the others that I have spent my productive year, like my young age in China, like studying from 2001 to 7 and then 10 to 17. So it's almost 13 years I've spent in China. It's something I don't know. Maybe it was God's plan to just take me to China. First time I was um, when I did my MBBS. Yeah, I like China. I love people there. I love the language, and yeah, that's really motivated me to maybe seek further in my career, like in plastic surgery. Uh, I would I would say they're well developed to in plastic surgery. That's the that kind of motivated me, or maybe it was, I don't know. I would say maybe for the second time when I went to China, it was more of God's plan that he took me from here, and I've me and my wife, we always prayed that we would come back after finishing our studies. So yeah, we love the language, we love the food, and we love the people there. It's
Wow,
yeah.
that's great. Okay. Nah, by the way, I see that uh, I hear about the quotes that a winner is a dreamer who never give up. So actually, what is your dream? That is right.
Oh, yeah. When you say my dream is to, yeah, because I work in this west part of Nepal, which is not that developed compared to the capital city. So after coming here, I realized that how what I can contribute to God's kingdom. Like to say, suppose uh, a wound is a big problem everywhere. Like
Mm,
plastic surgery need is big everywhere. So there are not many plastic surgeons in Nepal or even in many parts of the world. So uh, my dream is to like at least give people with a disability like leprosy or spinal cord injury or anyone who needs who is maybe burned or contractures who are functionally not doing well. Maybe I would say my dream is to give them a good, fulfilling life. Our quote from our organization is from John 10:10. Life in all its fullness. That's say that's my dream. Yeah.
Wow, that's great. Okay, so how do you found like, for example, like some people they are still confused like, uh, I cannot get about the patient and everything. So how did you find that I'm specialized in plastic and reconstructive surgeon? How can you find that? I think I'm here. This is my field.
Uh-huh. Yeah, yeah, maybe it's I don't know. It's when I started when I started as junior doctor when I finished my bachelor's. I had a chance to work before doing my plastic surgery. I had a chance to work
Hmm.
for 2 years with a plastic surgeon of Nepal, who was the first plastic surgeon. So he kind of introduced me to the field of plastic surgery. Then my interest grew, and I saw what plastic surgery can do to patients to change their lives.
Hmm.
Yeah. So knowing that there are only few plastic surgeons in Nepal, so that was my passion to like maybe this is the field, or maybe God has called me to this field to so I can contribute my special gifts or talents to this field. So that's also I liked taking care of patients and being close to patients. And when you're in plastic surgery, you get really close to patients because the patients will stay with you for a long time. Those rehabilitation patients, those needing a big surgery, and they stay with you for a long time, and you get really close to patients. And that's a bond that you have with them. And I think that's many more things that's in there. But yeah, these are the things you get really attracted to this plastic surgery field, I guess. Yeah.
Wow, that's great. So, friends, if you know that what Dr. Suraj do, maybe you can learn something from him. So, uh, actually, what makes you happy? That sometimes people, when he's doing the usual things, they getting bored. Like, what I'm doing. So, actually, what you do to make you happy?
Mm-hmm.
Hmm.
Oh, yeah. Um,
What
you
you
mean
do
beside
to
work,
make
or
you happy?
it's related to work?
Mm-hmm.
Like, is it
Hmm.
just work, or
Yeah.
besides work?
Mm-hmm.
Um, yeah, it's in my workplace. I really like to like with in my work, because I work with a team. It's just
Mm-hmm.
not just me. So I have my team. So I have my nurses, I have a doctor, and a physiotherapist and occupational therapist. I have so many team, big team. It's a big team. It's a teamwork. So what really makes me happy is when you talk about the patient to the whole group, and the whole group uh, uh, give some input for this patient's for the patient's benefit. I would say to give the treatment, to make treatment better.
So it's
So
like
even-
communication, right?
Yeah, it's communication with the team. Also, I when after coming here, what I found was the important field is the spiritual counseling. It's called its counseling part is very important, because when you think you're a plastic surgeon, you're healing wounds. You can heal physical wounds, but they might have some social issues or internal problems. So I would say
Yeah.
internal wounds. So for that, it's not just physical wound where you're healing. You're also a spiritual wound, or it's a psychosocial wounds. So it's more of when you call it, it's called holistic treatment. So it's a new term. It's a holistic treatment where you treat patients in a whole, not just what he presents. So yeah, that's a good thing. That has really made me happy working with the team here together. Yeah.
Wow, that's great. So the sometimes, yeah, I understand what Dr. Suraj says, friends, that sometimes when you're only alone, sometimes you feel that Okay, I'm doing everything alone, but when you have the team, when you have the people surrounding you, that's the time that you can celebrate. It's not laughing, you can laugh together. It's not only you're laughing alone. So the thing is like that. So it's good to share, by the way.
Can I
So
add something? Can I add
yes,
something?
yes, sure.
Yeah, it's, because my wife also works in the same hospital. So coming home, I share with her as well the patient's struggle. So it's nice to share with your wife and your struggles, and yeah, that's
Yeah.
important as well. Yeah.
Yeah, it's the same field, by the way. Okay, so Brother Suraj, from all the journey, you have, you're already going this far. Uh, what is actually the lowest point you have experienced in your life, and how you overcome it?
Yeah, the lowest
Yeah, it's not
point.
only about life,
No,
maybe about
no.
your work, about your
Yeah,
career, something like that.
yeah. Um, when we left China to come back to Nepal,
Hmm.
so the transition period was so uh, not nice. It was
How many years, by the way, you're in China?
second time I was in China for 7 years. So
So the total is 7 years.
no, totally it's 11 years, 11, 12
11
years.
years,
Yeah,
12 years. So,
yeah, 11, 12
gosh.
years. So transition from China in 2017 to come back here and work was a difficult time for us, like to
Mm.
settle and to be in a new place. And my lowest point was like I was I was just doing volunteer work, not earning. So it
Mm.
was difficult in a sense, like you have a family now, and yeah, you know that it's you don't have income. So
Mm.
yeah, that was my lowest point, where to move, where to go, and how would God provide. So yeah, it's because this is a mission hospital, so they depend more on funds from outside for paying my salary and all. So yeah, but yeah, slowly it went. We persevered for 9 months, and yeah, after 9 months, I had a proper job. So yeah, we celebrated. So that was the
Wow,
lowest.
that's
I would
awesome.
say that was my lowest point, where you know that you come here, you finish all your work, and you know that you're not paid. See, that's
Mm.
but yeah,
Yeah. Okay, friends. You know something that I learned about this story is like this. Sometimes when you're really in that time, in the lowest point, I don't think you can talk too much about it. What you feel like, maybe you feel only like, ah, gosh, I think it's only me who is the most lowest point. But the thing is, like, after you gone this far, hey, I can pass everything, and it's
yeah,
already in my back. So so the thing is like, what the Dr. Suresh tried to tell us is like this. Sometimes when we're in that position, yeah, we know, everybody's know that uh, everything is hard. Yes, we know about it. But the thing is like, don't stop. That's the thing. We should keep going because we
yeah,
never know about the future. That's the
yeah,
thing. The
yeah.
future will stop there only when you stop. But if you keep
Yeah.
going, it won't stop there.
Can I add something? Yeah,
Yeah, sure.
even that time, I was very much convinced that God would provide. So I was very much sure. So, and that gave me hope. And yeah, this even I knew that it was my lowest point, but uh, it would get overcome. Uh, yeah.
Ah, that's great. Okay. By the way, Suraj, I want to ask like about, because many people like me especially, I didn't do like the medical field. So,
Yeah.
how the teamwork in the medical field, like how it goes, and how like the manage, and how the coordination between one each other.
Yeah. So when you talk about the hospital, or maybe a department.
Mm-hmm.
So in a hospital, you have a administration field as well as clinical side. So clinical side is more of seeing patients and maybe admissions and taking care of patients. But the administration role is like taking care of finances, maybe provide needed IT support or logistics like maybe say computers, decks, whatever. So yeah, so it's a and maybe provide salary for doctors and nurses, whoever is working. Yeah. So from our side, it's a team of not it's not just a team where we might have a hospital director who is taking care of all this, and the clinician who is doctors who is taking care of a department. So we have nurses under us, and we have other junior doctors under us. So yeah, and the other, because we have we are rehabilitation center, so we have different other teams like physiotherapist, occupational therapist, prosthesis department, and speech counseling. They have so many departments in it. So when you look at the hospitals, it's a complicated network, but yeah, but it's all about communication to move forward, to grow forward. Yeah.
Okay. Wow, that's cool. By the way, we are talking about digitalization nowadays. I believe the whole world is facing this kind of digitalization since the phone is getting cheaper day by day nowadays. So that's why all the people can access all the information around the world. So, do you have like digitalization dream maybe in your workplace? Like, I think the workplace, if we do the digitalization, it will be like this, or any.
Yeah, it's a we are going towards digitalization. We have a proper software system to run the hospital, but I would say it's not properly managed. Maybe it's some more things to work on with us, more input from the doctors or from nurses, so we are going towards it. So yeah, as you've said, if there's proper digitalization or software, so it's easy to access data, or maybe research, or to share this data to others. It's easy access. And maybe right now with the smartphones, we can develop many apps, like maybe you have apps for proper patients data,
registration.
registration data, or even now is a time with COVID. Because of COVID, we've started telemedicine. You say maybe WhatsApp or video call or Zoom call, or so I see a positive thing with digitalization, we have I would say we have good network with good telecom network around Nepal. So it's a big possibility where we can move forward with telemedicine. Yeah.
Wow, that's great. Okay, I will quote a little bit what Dr. Suraja already tell us before, that digitalization is nice, but what he says, like, the software will be more proper to use if only it have more input from the doctor. So what I can get from here is like, sometimes the thing is like, the creator of the software is only create, but it's not his field or her field. Yeah, when make it, they only know like, okay, maybe it's like this, it's like that. So that's why Landmark is arrived there. So that's why we already experience, especially in the business field, we know that the software, if you want to make a software, you should really know about that field. Because if you don't know about the field, the software you use will be, it's not fun and it's not easy to use. That's the thing.
Yeah. Because it should be user friendly.
The expectation with the truth is different. That's the thing. Wow, that's great. That's cool, and I'm happy because Landmark can make it.
Yeah.
Okay. Okay, Dr. Suraj, before you talk about the dream, do you have a dream that's still ongoing? Like, I still have that dream and I still pursue it now. Your dream. I believe that dream when we are 10, when we are 5, 10, 15, until now 40, 30, it's keep changing by the time.
Yeah.
Yeah, it's keep changing. So did you still have the dream that's still going, or the dream? I have the dream before is like this. Maybe when I'm kids, I want to be the doctor, but now I become the doctor of IT. Like now. Did you have that kind of things in your life?
Yeah. Yeah, I would say, dreams might change a bit, but the broader dream is always the same.
Hmm.
But like as you grow, as you are mature, as you are more focused, I think your dreams also change a bit. So you can, I would say, my dream will be more focused now. So I would say my dream right now is to have a proper team in the hospital. So and maybe take care of the west part of Nepal, where you can have good plastic surgery service. So for that, it's not only a dream. You have to implement. You have to not just dream. You have to make it work. So you have to work on that as well. So that's the dream or plan. But with that saying, I'm also walking in that dream. Like I've tried to give some lectures in different places to let them know that we have plastic surgery service here and we can help. So the people won't suffer, the patients won't suffer. They don't have to travel all the way to Kathmandu or maybe outside of Nepal to get the treatment. So even the best treatment can be available here. So it's my dream to establish, to make this a proper plastic surgery center in west part of Nepal. So I've said that we have made links with the government hospitals. We've made links with other private hospitals, so they know that what we are doing, so they can easily consult us. And it's a betterment of the whole community or whole population in this part of Nepal. Yeah.
Wow, that's great. By the way, I'm always impressed by the doctor. Why? Because sometimes, what I feel that become a doctor is like this. When you're helping someone, when we are helping someone, what is it? This is in my mind. When we are helping, for example, a patient, and then suddenly this patient is cured. And then this patient is cured and everything is going well, like the beginning. So what I thought, when they say thank you to you, like the happy face, wow, it's really unpayable, isn't it?
Yeah.
Wow.
So just to share this, maybe a small story regarding this. I had a patient who was diabetic. So they come with rotten foot, like their infected foot, and she was really bad. Then I had to operate on her and maybe cut the part of her foot, like all the toes, and she couldn't walk. But her wound healed, cured, and she came after 3 months to see me. And because she couldn't walk properly because she didn't have a part of her foot. So what we did was we made something like our other team made the prosthesis, like a special shoe, so she could walk properly, and she was so happy. So I saw that smile on her face only after like 3 months. So that's the joy you get from. It's not just covering the wound. It's like giving them. Like making them do normal thing, like maybe walk. You see? So the plastic surgery won't stop where you do surgery. Not just that. It's also like rehabilitation part where you make them like functionally able. So yeah, I saw the smile on I saw that smile on her face after 3 months. Yeah.
Okay. Wow, that's cool, friend. By the way, the thing is, like, I like to, when I learn from our speakers, it's like this. If I correlate it with the business, it's same. In the business, what you need to do is you're helping first other people. What you need, which field you want to help. Because when you're helping, people will feel that, oh, this is the helping one. But we talk about business, of course, it should generate like some amount, so we can run this business. But the thing is, like, it start from helping. It's same like the doctor. The majority is like the first is helping, and then we get something for the payment. But
Yeah.
that's really great. The thing is, like, sometimes that kind of thing is not like is unpayable. What I learned is really unpayable when you see the face smiling because you're helping him. You're helping with the apps you made. You're helping them with the artificial feet you made. It's because of
Yep.
the technology. So it's really what I say is it's much more treasure. It's really great because the feel you won't forget. Even the face, I believe Dr. Surya will also not forget that girl.
Yeah.
Okay, wow, it's really great. Now, okay, the next question. This question I always talk almost with all of my guests. If you can get back to 10 or 20 years back or 10 or 15 years back, what you will say to 10 years or 15 years back to that Suraj? What you want to talk to him after you face now?
Yeah, maybe if you go back 10 years or 15 years, I would have said, "Oh, you should work much more harder. Don't be lazy."
Wow.
Yeah, maybe just maybe I would say you explore a lot. If I was like 10 or 15 years back, I would explore a lot, learn a lot. So I think it's more about learning, maybe more in the maybe digital way, more about computers or maybe softwares. Yeah. So I would say much. Yeah, 15 years back, I would say, oh, I would say you should do more of software engineering or whatever, maybe software part or
Wow,
it helps you a lot.
yeah.
It helps you a
Yeah.
lot to
Yeah, but medical software maybe. Wow, maybe that's the thing. Okay, friends, that's the thing. What I want to tell to our listeners is, yeah, sometimes we know, but there is never there is no words that say I'm too late. Everything still can be happen. I love what who is the founder of Kentucky Fried Chicken? I forgot. Mm, I forgot the founder. The founder of Kentucky Fried Chicken. Yeah, he also just start everything when he's 65. What I can learn is like, yeah, there is nothing too late. So for you, the listeners at home who listening for this ngebis show, the thing is like, yeah, just start it because everything will not start if you're not started by yourself. That's the thing. Wow, it's really great. Thank you for remembering me, Dr. Suraj.
yeah.
Because sometimes as a people we also forget. That's the thing. Sometimes we feel like, okay, just wait, hold it for a moment, but a moment it become a year or 2 years or 5 years.
Yeah.
So
Yeah.
hold it for a moment, it's become a year. Okay.
Never too late. You have to start. You cannot be lazy.
Yes, that's the point. I love it. Okay. What is your hobby, Dr. Suraj?
Oh, my hobby. Yeah, I didn't mention in the CV. Yeah, I love sports. I love sports. I love to run. I love to play football and basketball or tennis. I love all kind of sports, and I even love cycling here. Cycling is very famous in this Pokhara city. You got
Mm.
hills and mountains all over the world, all over this place. Yeah,
Wow.
yeah. I'm. We more must. We. I love trekking as well. I've recently I trekked to Annapurna, a big mountain place, some 4,200 meters high. I went for trekking. So I love nature, exploring nature. So that's my hobby, and I love to do some artwork, sketches. I do
Ah.
sketches of patients' hands. Yeah, yeah. Those are few of my hobbies. Yeah, yeah. I love to spend time with my kids.
Yeah, friends, when Suraj says about I love to sketch on hand and everything, I just imagine like he's doing the surgery. So sketches is like when you mixing about the stitching and knife and everything together into one. That's an art, maybe in his mind. But for me, I don't think it's an art. But for doctor, it's an art. When sketches, when mixing everything in your head, and this.
Actually, actually, it says surgery is an art. So
Yes.
if you, this good surgeon is if you are a good artist, then you're a good surgeon, I'd say.
Yeah, that's the point. So maybe the people here in Indonesia want to contact Dr. Suraj, you can contact him. I already put it.
Yeah, sure.
Wow, that's cool. Oh, my team says that you also you got COVID before. How you pass it?
Yes. Uh yeah, for COVID. Uh, it's, COVID is a big problem here.
Hmm.
Even during our time at work, it's a big problem. We had the hospital was almost shutting down because of COVID, and
Hmm.
yeah, COVID. It's two two big waves. There were big lockdown periods, and uh, especially in the lockdown time, we had our second child. That was a bit difficult to travel to the hospital and back, and
Hmm.
yeah. So COVID uh, has really changed the dynamics of our living. Not just us here in Nepal, maybe in Indonesia and different parts of the world. But yeah, I would say uh, we will overcome COVID. And with this, it is promising that we're all getting vaccines. We are fortunate that we got vaccine early in January because we were medical personnel, so we got COVID vaccine early January. So yeah, still, even if you have if you're vaccinated or not, or if you had COVID before, you can still get COVID. And there's another
Oh.
challenge. So yeah, it's just that you might the symptoms might not be that severe. So yeah, I would say just take care of yourself, like social distancing, put on a mask on during work. Yeah, you could just
Okay. Okay, friend. That's the thing. Because Dr. Suraj is a doctor, so he cannot do the social distancing when somebody's need him. That's the thing. So
uh,
make sure you still keep social distancing,
uh,
use the mask, so all the doctor in the world can also be safe to helping much more people in need. Because uh,
yeah,
the thing is like not the patient is not only like the COVID, the one who got COVID, but there are many people who still need help beside COVID. That's why
yeah.
we need to take care of ourselves. Okay, uh, talking about you study in China, and then uh, what impact that you bring to Nepal after you doing school in China? What do you learn much from China, and then you think,
Yeah.
I should bring this kind of thing to Nepal.
Yeah, when you say about China, it's the people or the doctors whom I work with. They're so passionate about their work and
Ah,
the hard work they put onto their job and to their studies. And yeah, they're so passionate. And when they take certain task, they complete it, and they put so much effort, like all their energy to it to make it complete. So that's what inspired me from education in China. Like, just work hard, put your heart and soul to what you've done. Yeah, that's truly inspiring. A few of my friends who were really good friends of mine, whom I worked with in China in university, maybe during my PhD as well. My friends whom I work with, they were so much. They were working so much hard in their respected fields, and I see even when I look at Valentino, he's one whom I met in China, and yeah, see, even you are influenced by Chinese people. So yeah, that's why I like about China. Even when you see that big development in China with the railroads and bullet trains and all, so they're so much into hard work, their determination and their dedication to their work. Yeah.
Okay, wow, I love it. The quote I got from Dr. Suraj is about what he learned from China and he bring to Nepal is about the hard work. And the thing is, like, the hard work when the doctor, because he learned it from the doctor back in China, and hard work and make sure you finish what you already take. For example, you take this job, so make sure you finish that job. Don't make it like, I cannot finish it. Okay, just leave it. So it's not like that. What I learned. So it's same like you guys, friends. When you're doing business, it's also the same. When you already make decision, okay, I will do this, I will do that, I will take this business, and I will do this business. Make sure you finish it. If you cannot finish it, you should drop down everything that why I cannot make this happen and possible. So you can finish what you already start. I really love it that. It's really great. So make sure you finish what you already take. Or wow, that's awesome. Ah, oh, we already talked for 46 minutes, by the way.
Oh, time is flying.
Yes, time is flying. Okay, Brother Suraj, is there any like, if in case like the people here who is listening, they want to know like actually what is Nepal made for export? In case you know, like or any commodities that Nepal needs, like for example fish. Indonesia, there's a lot of fish. Who knows? Because I have a lot of friends who doing export for the fish. Maybe you know about it. So the Indonesia exporter can have cooperation with the Nepalese.
Yeah. When I said Nepal, it's a landlocked country, so we don't have sea. So it's as north you have China, the Tibet part, and south and east and west you have India. So we are landlocked, all land. So we don't have seaport. So that's what makes it unique, and it's difficult to export things because you have to get everything through India or even maybe through plane. So for Nepal, it's traditionally it's good in art. Maybe handicrafts would be the best thing, or even they make those what do you call those, the statues or metal work, artwork. That's very which I see many has done good business, maybe to Europe or different parts of the world, even to China. And those artwork like what do you call those artwork? So I would say just artwork, maybe handicraft or these metalworks. I would just say that. Other things that can be exported through here is more of I would say, I don't know. I got stuck. Maybe I would say just handicrafts for now.
Okay.
Imports, many things that can be imported here. If you just mentioned Indonesia is famous for fish. Yeah, because I turned vegetarian, so and I started eating fish. Now, so I love tuna. So mackerel, tuna. So
Okay.
those
That's great.
are nice food items you can export from Indonesia, or even Indonesian handicrafts, or Indonesian artwork. What else? I cannot think of much. Maybe software.
Yeah, who knows? One day we will go into Nepal.
Yeah.
By the way,
Yeah.
friends, if you know that Nepal is like they have a lot of mountains. What is the famous mountain there?
Yes. If you say about Nepal, it's the north part is whole Himalayas. That's
Himalayas.
tallest mountain in the world. That's Mount Everest is the tallest mountain in the world, and it's very the place is very famous for tourism, to trek and to maybe go to base camp. So the place I'm living here is famous for another trek. It's called Annapurna Trek, which is one of the famous trek in the world. So I would say welcome to Nepal especially for mountaineering. Visiting.
It's for you, friend, who love to hiking, trekking. But you should prepare your power because it's really high. What I know.
But I've done a couple. It's right now it's easy because you have proper guides. Proper lodges, and you can do bit by bit maybe, and there's more road accessible where you can go in a vehicle to most distant places, and you can just walk a few days, and so it is a lot easier than maybe 10-12 years back.
Wow, that's cool. It's happy news for you who love to trekking. To trekking to it's Everest.
Himalayas,
right? Himalaya.
Everest or Annapurna. They have so many trekking routes. So if you go to highest mountains, it's Everest Base Camp. From here, you can go to Annapurna Base Camp. So there are different base camps. You can travel. You can trek. So it's nice. So this is this season is the best season. Autumn, like October, November, is the best season to travel. Otherwise, it's more snowy in December and avalanche and more accidents in the mountain. So,
I see.
So this is the best time, and maybe the other best time would be March, April. So these are few best times you can do trekking.
I miss it. I hope I still have time.
Yeah, you guys are welcome. But again, COVID is a big issue here.
Okay. Okay, I will ask. This is my last question actually. Before I already talk about your lowest point, and I want to talk about what is your biggest achievement that you will always be remembered. I always remember this achievement in my life. What is that?
I would say biggest achievement. I have to list out my biggest achievement.
The most one.
Maybe. I would start with my family. I'm married to a wife, beautiful wife, and 2 kids. That's the biggest achievement as well. And
Yes.
the work-wise, I would say my biggest achievement is to be in this place and know that whatever I'm doing is, I would say, greater glory for the Lord. And we feel so much blessed with our respective work, not just mine, but my wife's as well. So we are very much blessed to work in field of disability, where you see the life their change in their life, like you're giving this you're helping them to have a beautiful life. So I would say that's the biggest achievement which you've learned, and it has kept me humble, not like boasting on what I have achieved. So yeah, I would say to see this life change through small help you can do through surgery or through your team. Yeah.
Okay. Wow. Thank you so much, Dr. Suraj. Your closing statement, any motivation or quote for our listeners?
Mm-hmm. Yeah, again, it's I'm not good at quotes, but I would just say this again it's my quote from Bible, which it says from Jeremiah. Whenever you're down and out, you have to believe, you have that faith that the Lord has plans to prosper you, not to harm or not to sadden you, but he has plans to prosper you and give you a bright future, a very bright future. So we are here, and we are here to do something. We have everyone has purpose in their life. So be encouraged in whatever field you're in, and just do your best and give your best and be happy. Yeah.
Okay. Wow, that's awesome. Do the best in your field. Be encouraged and be happy in what you're doing, because that's only what you do. What we can do. I mean, that's awesome.
Yeah.
So,
That's
friend,
and if you're happy, you are influencing others as well. Oh, they'll see. Oh, this guy is so happy. So you're passing that happiness, like.
yes, of course, because it's infected. Happy is
Yeah.
infected.
Yeah.
Infecting other people. So that's awesome. Okay. Well, thank you so much, Dr. Suraj. Let me close for our listeners for a while. Okay, guys, thank you for Dr. Suraj for the time. It's already 55 minutes. We're talking so much about many things, about ups and downs of life, and also about Nepal. He's talking about story about Nepal and everything. So the thing is, like, we need to always learn day by day. We're not stopping. That's the most point, what I get. We're not stopping. Keep learning, keep doing, and also when you're already when your creator already put you there, make sure you do everything. What can I say? Like, do everything like with all of your power, so everything can be great at the end. Because sometimes you never know about the future, but the thing is, like, the future will be great as long as you put all your effort into there. And always, don't forget, be happy and thankful for everything. Okay, thank you so much, Dr. Suraj, for the time.
Yeah, thank you.
Say
Thank you for inviting me. Yeah.
Say our greet to Sister Amrita and all the kids. Okay,
Yeah, thank you so much.
guys.
Pass my greetings to Evelyn and Karina as well.
Yes.
Yeah.
Guys, next week we will have a talk with Sister Zarina. He's from Ukraine. We will talk because she can talk 6 languages. How? Let's see you next week, okay? See you. Bye-bye.
Bye. Yeah. Nice talking to you. Bye.